We just talked about lymphatic organs. Do you remember the primary versus secondary? What were the primary lymphatic organs? There's only two. Red bone marrow and thymus. Right. All the rest are secondary. We're going to be looking more at primary lymphatic organs when we talk about the specific or adaptive immune system. Right now, we're just going to focus on some of the secondary lymphatic organs. Let's look at lymph nodes first, because you have bunches of them, and they do a really important job. So what do they filter? Remember, they filter lymph. Also very important in activating the specific immune system. So we'll see that when we hit the specific or adaptive immune system, that, kind of like the whole Paul Revere idea. When bad guys first come in, white blood cells spot the bad guys, but then they have to alert all the rest of the lymph system that bad guys are here, the rest of the immune system. So we'll see that this lymph nodes are important for that. There are several afferent lymphatic vessels leading in, but only one or two efferents leading out. So look at that lymph node on the right there. You can see it shows 1, 2, 3, 4 afferent lymphatic vessels leading in, but there's only one efferent leading out. Now, what's going to happen? Imagine you had a sink with, a sink has one drain and one faucet, all right? Normally, if you turn on the faucet, the drain can handle it. Imagine if you had a sink that had 4 faucets. What might happen if you turned all 4 on, but there's still only one drain? Yeah, the sink might overflow. But in this case, because the lymph node is closed, it can't overflow. So what does that do? It basically just increases the pressure and slows everything down, all right? You've got all this fluid coming in, and there's only one way to get out. It's kind of like, when you cross the border, and there are a bunch of lines, but they all merge into one. Everybody has to go through that one turnstile there at the end. So that's what's going on. What this does is it basically causes everything to slow down to a crawl. And why would you want to do that? Because now it gives all those lymphocytes in there a chance to really scan the fluid and look for bad guys. So again, looking at all those purple ovals in there, those are all lymphatic follicles. Those are full of lymphocytes. And so as the lymph flows in, you've got tons of lymphocytes who are just checking. They got a little, again, remember lymphocytes are T cells and B cells. Oh, got that Rona. They only are designed to kill one thing. So like, there's there's like a measles T cell in there. And it's got like a little pictures of what the measles look like, all right? And so it scans the lymph coming in, and if it sees, people that are not measles, it's just like going, hey, hi, how are you? Hey, how you doing? Oh, nice to see you, huh? And then what happens if it sees measles? Just pulls out the Glock 9 and shoots it dead right there, all right? That's what you want to do. So that's the whole point of a lymph node. And that's why you have several afferents, but only one or two efferents. This is a word we might see coming up again, stroma and parenchyma. So a lot of organs we divide up into what's called the stroma and the parenchyma. The stroma is basically it's like the infrastructure. It's like the walls and the doors and, it's reticular fibers, cortex, medulla. It's kind of like the casing. It's kind of like, the walls, the floors, the stairs, whatever. The parenchyma is all the actual working stuff. So it would be like the people inside of the house. The lymphocytes, the macrophages, the dendritic cells, etc., okay? So a lot of organs. Just get comfortable with those words. Stroma is like the structure. Parenchyma are like the working parts inside. So lymph nodes, you've got tons of them. You've got 400 or thereabouts lymph nodes. 70 cervical and in your head. 30 axillary, remember that's your armpit. 20 inguinal and popliteal, so down in your groin area and on the back of your knee. 100 thoracic. And then look at 230 abdominal pelvic. Yeah, because, that's where all the food and stuff is going, all right? That's where a lot of the pathogens are getting into your body. So you've got tons of lymph nodes down there looking, that piece of pizza that sat on the counter overnight and you decided to eat it anyway. Oh, my God. That was crawling with bacteria and viruses and amoebas and parasitic worms. And so thank God you got tons of lymph nodes down there just watching for all that stuff on the pizza, okay? There you see a lymph node, all right? You can see the lymphatic follicles. All lymph passes through lymph nodes. And also here, notice there are blood vessels. White blood cells get in and out of the blood very easily here, all right? So white blood cells hang out inside of the lymph nodes, all right? Tons of them, lymphocytes, macrophages especially. They're all hanging out inside of the lymph node watching for bad guys, all right? So let's look at some things that can go wrong. Remember, I tried to kind of hint at this earlier. What was one of the purposes of the lymphatic system? So when blood plasma leaks out in the capillaries, has to get recovered. Some of it gets recovered by the venule, but like 2 to 4 liters a day has to get recovered by the lymphatic system. So what can happen if your lymphatic system is for some reason blocked or not functioning correctly? Well, you can end up with lymphadenitis, for example. So inflammation, swelling, and enlargement of lymph nodes, all right? So these are infected lymph nodes. Lymphadenitis, remember, inflammation. So inflammation of lymph nodes, all right? So they're filtering all the stuff. If bad guys get in there and they get overwhelmed by the bad guys, then they can get infected. And now you have lymphadenitis. So lymph nodes, infected ones, should be tender, all right? They should be kind of a little painful to the touch. They should be large and swollen, but not firm. They should be squishy. And you should be able to move them around. So that's one of the things the doctor will do sometimes, like if you guys come in, you got a sore throat, the doctor will put his or her hands, under your chin, under your jaw, the way they do, and they kind of feel around in there. What they're doing is they're feeling for your cervical lymph nodes. And what they're hoping is when they press on them, you go, ow, all right? A swollen lymph node would be a sign that you got something like strep throat, all right? You got some kind of an infection. And they should be swollen, and the doctor should be able to, the reason they move their hands is they're trying to move them around a little bit. They should be movable. So this is not a time to be macho, by the way. When the doctor pushes on those lymph nodes and it hurts a little bit, don't think, oh, I'm not going to show that I'm in pain. No, that's a diagnostic tool. You should let the doctor know, yeah, that's a little tender there. That hurts a little bit, okay? Cancerous lymph nodes, which are lymphomas. Anytime you see oma, that's normally a root word that's going to mean, or a suffix that's going to mean a tumor of some sort. So if you have a lymphoma, that's a cancer of the lymphatic system. So a cancerous lymph node, all right? These, in contrast to normal infections, these are typically not tender. They're painless. Do you see why you don't want to play macho with the doctor? They're enlarged and swollen, but they're firm. They're not squishy. They're kind of hard. And then they don't move around easily. They're firmly attached, okay? So that's why, this is a good diagnostic tool, telling the difference just between, a strep throat and somebody who actually has a cancer, a lymphoma, all right? And the woman in the illustration on the left, this just breaks my heart when I see things like this. There is an example of a woman who has blocked lymph nodes, blocked lymphatic vessels. They normally would drain the tissue in the breast, but because they're blocked for some reason, we don't know, I don't know this picture where it came from, but now you have the edema. You have all the lymph that's backing up. It can't flow through, it can't drain, so it's backed up into her breast. And so her breast is incredibly enormous and enlarged. Again, it's just, God, that would never happen in Western civilization. I mean, where we have clinics and hospitals and urgent care. But remember, there are people in other parts of the world that don't have things like that. A lot of people in sub-Saharan Africa, there's no hospital or clinic anywhere nearby. I mean, you think this woman doesn't wake up every day and look at herself and see that that's there? Again, it just breaks my heart that people have to live this way. It would be so easy, if there was just a nearby clinic or a hospital. I mean, at this point, they would just do a mastectomy. They would just cut that off. But at least she wouldn't have to carry that around every day. That's just so sad. Okay, let's talk about the spleen. Large organ in the upper left quadrant. Make sure you know which side of the body your spleen is on. Stomach on the left, spleen on the left, liver on the right. The stroma is a thin capsule containing smooth muscle, all right, so that it can enlarge and contract. And then it has trabeculae. Remember, we've seen trabeculae a bunch of different places so far. We saw them in Bio 201 in the spongy bone. And now here we see them, trabeculae. We saw them, the carni trabeculae, in the heart muscle, all right, in the ventricle. And now we see trabeculae in the spleen. And the parenchyma, the working parts, there's what's called the white pulp, which is composed of lymphocytes and macrophages that surround ingoing arteries like a sleeve. And then there's the red pulp, which is leaky sinuses where blood flows slowly. So remember, the spleen is where you recycle your old red blood cells. So the red pulp has the big leaky sinuses where old red blood cells get recycled, all right? And then the white pulp is basically, why does it look white? Because it's lymphocytes and macrophages, white blood cells. They completely surround the incoming arteries, all right? So look in that illustration in the upper right, you see around the artery, see where it says white pulp? That's just a big massive collection of lymphocytes and macrophages. Through diapedesis, they can get in and out of the blood, all right? And then notice you also have the red pulp as well. So the red pulp is where you're recycling those red blood cells, and the white pulp is where you've got all the white blood cells that are basically looking at anything coming down through the blood. And if you've got bad guys in your blood, if you've got bacteria, viruses, things like that in your blood, then you've got the white pulp of the lymphocytes and the macrophages that are ready to kill it, all right? Again, we mentioned this before. You've got lymphatic tissues all through your body. And the whole idea of the lymphatic tissues is that they're often in places where bad guys are likely to show up. That way you can kill the bad guys in case they do show up. Spleen does a lot of things. Let's talk about just a few of them here. It filters your blood, all right, very important. Removes dead or defective red blood cells, all right? Remember, red blood cells last 3-4 months, and then they have to get recycled, have to get broken down into their component parts. Remember, the heme will eventually be processed, turn in, you can make those pigments, bilirubin, biliverdin, urobilinogen, urobilin, stercobilin. You get all those colors of urine and feces and so on. And then the amino acids simply get recycled to make new proteins with. But that's happening in the spleen. That's where it's breaking down those old red blood cells. Also then, in the white pulp, removes pathogens, toxins, and debris, all right? Those macrophages and lymphocytes are killing any bad stuff that gets in there. It's also a blood reservoir. So there's smooth muscle in the capsule that can contract. So what's happened right now, like you're just sitting out there farting and thinking about sex, your spleen is full of blood, all right? So the smooth muscle can relax and allow your spleen to dilate, to become larger. It becomes enlarged. And then if suddenly you have to jump into action, that smooth muscle will contract and the blood will come out of the spleen so that it can go from now to your heart, to your skeletal muscles, and so on to help you survive in a crisis situation. So the spleen works as a reservoir of blood. I mean, it kind of goes back and forth. In times of inactivity, the spleen enlarges with blood. In times of activity, it contracts and the blood goes to where it's needed for activity, all right? Splenic volume decreases 40 to 50% in exercise. So, the spleen loses half of its volume during activity. Then it's a platelet reservoir. About a third of your body's supply of platelets hang out in the spleen. Produces red blood cells in the fetus, possibly later, so that's not something that's relevant for adults anymore. But remember, we make red blood cells in the red bone marrow. In the fetus, some can be made in the spleen. And then immune functions, it does what's called immune surveillance. So as those red blood cells come in to get recycled, you've got the lymphocytes, the white pulp, that are basically checking them over to see if there's bad guys. Later, we'll see that complement proteins can stick bad guys onto red blood cells, and that way they ride to the spleen where the lymphocytes will kill them. And also, it's a place where lymphocyte proliferation and activation takes place. So remember, we talked before about how when you get invaded by bad guys, the immune system has to become alerted, has to become activated. We'll see white blood cells release various chemicals, things like cytokines and stuff. And what those do is those alert the rest of the immune system that the bad guys are here. And so what will happen is here in the spleen, lymphocytes will proliferate. So you can multiply your lymphocytes to make more for whatever particular bad guy came in. Clonal colonies, we call them. So, hanging out now in your spleen, you've got lymphocytes. Remember, they're special for each different bad guy. You've got lymphocytes for hepatitis and for polio and for measles and for strep throat and for coronavirus. Well, normally you've only got a few. But if you get invaded by one of those things, like if you get coronavirus, then the coronavirus lymphocytes will start proliferating. They'll start mass reproducing, okay? And the spleen is one of the places where that can happen. So what can go wrong with the spleen? Well, splenomegaly means an enlargement of the spleen, okay? So inflammatory, for example, infectious mononucleosis. Infectious mononucleosis, very common. Lots of people get it, the Epstein-Barr virus. I had it my freshman year of college. College dorms. People are exchanging saliva like crazy in college dorms. So it's not uncommon to have lots of college freshmen who are in live-in dormitories come down with infectious mononucleosis. I had it. And what happens is your spleen gets enlarged, and your spleen is so vascular, by the way, that if it ruptures, you can lose serious amounts of blood. Remember, it's a blood reservoir at rest, so you have to cut down activity. I was playing baseball at that time, and I had to take time off from the baseball team because when I got the mononucleosis, my spleen enlarged, and if I'd gotten hit, like sliding into base or something, and my spleen ruptured, that could have been serious, all right? So I had to cut out all activity during the time I had the enlarged spleen. Also congestive, so things like heart failure, portal vein obstruction, the hepatic portal vein, cirrhosis of the liver, all those things can cause the spleen to enlarge. Also, you can get tumors and cysts, okay? So what happens if your spleen is damaged? Well, normally they will do a splenectomy. Ectomy means you cut it out. That's surgical removal. It's very difficult to fix a spleen because it is so incredibly vascular. It's so full of blood vessels and blood that it's very difficult to repair. They normally just take it out. So trauma, car accidents, whatever, sports, or if you got some kind of clinical condition that would be improved by removing the spleen. So very vascular, very difficult to repair, so they normally just cut it out. You can live without a spleen, but remember the spleen was recycling your red blood cells. Who's going to take over? Do you remember? Who takes over recycling the white blood cells if you have to have or the red blood cells rather, if you have to have your spleen removed? That's your liver. Liver is the backup organ for that. So some other lymphatic tissues here where things can go wrong. Edema. So remember what causes edema? Well, fluid, plasma leaks out of the blood, becomes interstitial fluid. That should be picked up by the lymphatic capillaries and then transferred through lymphatic vessels, which will ultimately drain back into the subclavian veins. Well, if anything along the way blocks that, then you end up with edema. Why is edema bad? Well, edema can push cells away from blood cells, all right? When things swell, then, everything kind of expands. And now some cells of your body may get pushed so far away from blood cells that they can't get oxygen and glucose. And then you can actually end up with necrosis. You can actually end up with cell death and tissue death. Also, edema will be painful normally because all that extra fluid will press on nociceptors. Remember nociceptors from Bio 201? Pain receptors. So lymphatic system normally designed to prevent edema, but if it gets clogged up, you can end up with an edema. Lymphomas are tumors of the lymphatic system. There's Hodgkin's lymphoma, discovered by Dr. Hodgkins. Usually that's a very good prognosis. Non-Hodgkin's lymphoma is more variable. Some non-Hodgkin's lymphomas are good prognosis. A lot of lymphomas now are survivable, treatable, some more than others, all right? So it just kind of depends. We're not going to try to learn about that here. I don't know all the details of that. I'm not a practicing physician. But if you go to medical school, nursing school, you may learn a little bit more about that. I don't really know. And then elephantiasis, all right? Elephantiasis, very interesting. This is a parasitic roundworm infection. Happens a lot in the tropics. So roundworms get into the body and then they clog up the lymphatic vessels. Therefore, lymph can't drain, and therefore you get edema. And due to gravity, where is this mostly going to happen? Where are those parasitic worms going to end up? They're going to end up down in your lower extremities. So what happens is you get edema in your lower extremities, and it makes your legs swell up to look like an elephant's leg. That's called elephantiasis. By the way, the lower left-hand illustration, that's a kid who's got lymphoma. That's cancer of the lymph nodes. That's I don't know any of the details of that picture, but that's what it looks like. Big and large lymph nodes. Now remember, are those going to be tender or painless? Painless. Are they going to be squishy or firm? Firm. Are they going to be movable or non-movable? Non-movable, okay. And there you see elephantiasis, also called lymphatic filariasis. It's called that because mosquitoes, when they bite humans, they will infect you with a type of roundworm, a filarial roundworm it's called. So that's why it's called filariasis. It's a filarial roundworm, and it blocks lymphatic flow, so you end up with elephantiasis. Roundworms affect lymph nodes and block the flow of lymph, resulting edema and fibrosis leads to elephant-like thickening of the skin. Now, be very careful here about terms. Notice this is elephantiasis. It is not elephantitis. What would elephantitis mean? Remember, itis means inflammation, so what would elephantitis mean? Elephantitis would mean there's elephantiasis, here is elephantitis. Elephantitis would mean inflammation of the elephant. Okay? Watch out for this on any quiz or exam. If you put down elephantitis, that will be -50. The term is elephantiasis. All right? Elephantiasis. And look at that poor kid's lower leg there. Gosh, look at all. See how the skin has become, you get this fibrosis of the skin, thickening of the skin. I'm not sure what there is to do for this kid. I'm not a physician. I don't know how this works. I don't know if that's really treatable or whether it basically just comes down to amputation. I don't know. But you certainly don't want to get like that. And again, this just makes me so sad. I just cry inside when I see things like that. If this were to happen in Western civilization, a kid would go to a clinic or a hospital or an urgent care. They would have taken care of this long before now. This only happens in poor parts of the world. So here's a cool thing. I had this girl in my class a couple of years ago, Marissa, and after we did this lecture, she went online looking to learn more, because that's the kind of student Marissa was, and she found this website, and they showed, for the lymphatic system, look what it says, elephantitis. And Marissa texted me immediately and said, this person gets -50 points. And I said, it's amazing how often that shows up on the internet. I'm going to email them and give them hell. Marissa says, right? I don't think I can trust this YouTube channel now. And I said, send me the link. Well, she did, but before she sent me the link, she actually left a comment on the YouTube video. And here was in the comment section for the video. Somebody else said, wow, what a great clear video. I learned more in this 10 minutes than I have in 6 hours of my AMP2 class. I'm sorry, sweetie. I'm sorry your AMP2 class was that bad. But look, Marissa says, get 'em, Tom. I added a comment. Now everyone will know. Notice Marissa commented elephantiasis. It's not elephantitis, it's elephantiasis. And I told Marissa, I said, we're superheroes saving the world from dumbasses. Damn straight. And then when I went, she sent me the link, and when I went to the website, to the YouTube video, it already had changed. It says, correction, elephantiasis. I said, I just watched it and had this, and Marissa says, hell yeah, we are. Oh, good, probably didn't show up on my phone. I'm going to claim this because of you. Get ready to be famous. And Marissa said, hell yeah, bitches gonna be jealous. All right, so that was so cool. Just in the time that Marissa made her comment and the time I got to the website, they had already collected it. So, yeah, Marissa then sent me this. Bitch, I know I'm so fabulous. There's Marissa. I love her to death. Marissa worked at REI. At the end of the semester, she gave me a dry bag. She used her employee discount and bought me a dry bag. And dry bags are really cool because when I go up to the Grand Canyon and southern Utah during the summer, it's during the monsoon season up there, and I often get caught in thunderstorms. And I have my very expensive camera with me, and so I got to have a way to keep my camera dry. So the dry bag that Marissa bought me is just perfect size for my camera. So I carry it with me now, and I think of Marissa all summer long when I'm on my summer adventure, because every time the thunderstorm comes, I reach into my pack and grab my dry bag that Marissa gave me, put my camera in there. My camera stays perfectly dry all throughout the thunderstorm.